This video will address the concepts of isolation and safety after having a stroke. But before we dive into these concepts, let's take a moment to review what a stroke actually is. There are two types of strokes: ischemic stroke, where blood flow to the brain or a part of the brain is blocked by a clot, and a hemorrhagic stroke, which is caused by a bleed in the brain, often a rupture of an aneurysm. Both hemorrhagic and ischemic strokes can lead to physical and mental deficits depending on the part of the brain that is affected. There are many risk factors leading to a stroke, and they can be divided into modifiable and non-modifiable risk factors. Modifiable or changeable risk factors, meaning you can take measures to change or reduce them, can include hypertension, which is one of the most common risk factors, smoking, which can damage your vessels, which would lead to blockages, obesity, lack of exercise, heart diseases relating to your carotid arteries that supply the blood to your brain, substance abuse, diabetes, and atherosclerosis, which is plaque buildup, and it can travel through the arteries up to your brain, leading to a stroke. Non-modifiable risk factors can include your age. The older you get, the more at risk you become. Also gender. Studies show that women are at higher risk for stroke than men. Family history. If one of your family members has had a stroke, you may be at a higher risk. And also race, including races such as African Americans, Hispanics. They are shown to be at a higher risk. It is important to stay active, have a healthy diet, and talk to your doctor to lower your risks. Now that we're clear on what a stroke is, let's begin to look at isolation and safety. During the first half of this video, we will discuss how to cope with and reduce isolation. The second part of this video, we'll talk about important safety measures to take after having a stroke. Part 1. Isolation. This part of the video will help us to define what isolation is, who's at risk for being isolated, what are potential causes of isolation, and finally, what can be done to reduce the risk of isolation. First, let's begin with understanding what isolation is. Isolation can be defined as a feeling of aloneness. The person experiencing isolation may perceive this as being imposed by others around them and as a negative or threatening state. Characteristics of isolation can include a lack of support system, feeling different from others, a feeling of purposelessness, and an inability to meet the expectations made by others. This feeling of isolation can be caused by some of the changes in physical appearance and the altered mental status, both of which can be caused by strokes. Drastic changes in social, household, and professional roles can also lead to isolation. An example of changes in roles could be that the regular caretaker in the household has had a major stroke and is no longer able to continue in this role as the caretaker and must become accustomed to being taken care of. One way you can help prevent isolation is through community resources. Resources such as support groups can help individuals to feel accepted and supported. Community resources can help people feel as though they have a purpose and reduce the feelings of aloneness. Isolation isn't only something to think about for the person who has had a stroke, but also for their support system and family. Caregivers can experience isolation as well. When caring for somebody who has had a stroke, it is important to ensure you are still taking care of yourself and taking time for you. Overworking yourself can lead to what we call caregiver burnout or caregiver burden. This occurs when they become overwhelmed with caring for the patient. One possible solution for caregiver burden is something we call respite. Respite provides relief for the caregiver so they can socialize with friends or just take some time for themselves and relax. This is something we recommend for all caregivers to reduce the risk of burnout and isolation. Part 2. Safety. This part of the video will look at the importance of safety and how to reduce the risk of falls. Safety is a very important concept to consider after having a stroke. It's important to remember that your mind and body may not function the same as they used to, so it may take some time to get used to your body again. A simple safety intervention to put in place is non-slip socks. These are socks that have little rubber pieces on the bottom to help stop you from slipping. If you are unable to get non-slip socks, another alternative could be wearing fitted slippers or a slip-on shoe. All these options reduce the risk of falls while indoors. Another option for safety procedures is using a raised toilet seat. Having a raised toilet seat makes it easier to sit and stand up when using the bathroom. It allows you to use less effort when sitting down and standing up. It puts less strain on your joints and less stretch on your muscles. If you are experiencing any weakness after a stroke, this can reduce the risk of falls and reduce the amount of assistance you might require while using the bathroom. Something else that can go along with the raised toilet seat is handrails. They can help you to sit down and stand up while using the bathroom, but they can also help stabilize you while you are sitting down on the toilet. As you get used to the new way your body functions, you may be required to use a mobility aid, such as a cane or a walker, to walk and move around. Mobility aids can be useful when experiencing weakness to either one or both sides of your body. They reduce the strain on your muscles and joints. They help keep you stable while standing and greatly reduce your risk of falls. Another important strategy for reducing your risk of falls is to keep walkways and pathways clear of clutter. This can be done by removing tripping hazards, such as throw rugs and other small items like dog or cat toys. After having a stroke, you may be experiencing some vision problems or loss of sensation in one or more parts of your body. If you are experiencing vision problems, you might not be able to notice when some of these items are in your path, ultimately causing you to fall. With loss of sensation, you may not always be able to feel when you are stepping on something that may cause you harm in some way. These deficits, along with increased clutter, greatly increase your risk of tripping and falling. The risk is greatly reduced when walkways are kept clear of clutter. As we know, after having a stroke, your vision may not be the same as it was before, therefore increasing your chances of having a fall. Since it is more difficult to see in the dark than in the light, it is recommended that walkways and hallways are kept well lit. An example of this would be ensuring that the path you take from your bedroom to the bathroom is illuminated at night in case you wake up needing to use the bathroom. The extra light helps you to find your way while noticing items that may be on the floor or any steps that may be present along the way. It is important to stay in contact with your primary healthcare provider and schedule regular follow-up appointments. They can monitor your recovery process carefully and recommend specific safety interventions as well as possible medications that you may need. With close monitoring, your healthcare provider will be able to detect any improvement or decline in your recovery process and react accordingly. And of course, if you have any questions at all, do not hesitate to contact your primary healthcare provider. And thank you for watching this informative video on isolation and safety. We hope this information was helpful to you and your loved ones.